The proposal before us delays government subsidies for yet an additional year to hide the real cost, Mr. President, of the bill and show so-called additional savings. Mr. President, stalling implementation on a program set to run for an indefinite time horizon and calling it savings is nothing more than a fiscal sleight of hand. Therefore, Mr. President, the Senate Budget Committee estimates that the true 10-year cost of the proposal to be $2.5 trillion once fully implemented. $2.5 trillion once fully implemented. Let me say that again, Mr. President. $2.5 trillion, a lot of money. And to pay for this $2.5 trillion worth of legislation, the government, I believe, will have no choice but to raise taxes to European welfare state levels or, Mr. President, impose drastic restrictions on patient care, or most likely both. The bill, Mr. President, includes over $493 billion in new tax increases as written, and probably another $464 billion in Medicare cuts, placing the burden of reform squarely on the shoulders of the middle class, small businesses, and the elderly. For the middle class, the proposal is a direct hit. The Joint Committee on Taxation estimates that in 2019, 73% of the so-called wealthy taxpayers paying the proposed excise tax on high premiums will earn less than $200,000 a year. Mr. President, I think the time is now to stop heaping debt obligations on the backs of the able-bodied. The proposed tax on the so-called Cadillac plans with high annual premiums, will not only be passed on to the consumer through higher premiums, but, Mr. President, will creep its way into the lives of many middle-class Americans. I have a little story. Miss Melanie Howard of Pelham, Alabama, raised this point when discussing the idea of who actually receives Cadillac health care. Mrs. Howard spoke to me of the small nonprofit where she worked, which had to raise premium prices, Mr. President, to offset a few workers who were battling cancer. In effect, she was paying for a Cadillac, but still just getting a basic car. Because the tax is based on cost of coverage and not quality and breadth of coverage, many Americans could fall into this category. I believe it's a simple actuarial fact, Mr. President, that smaller risk pools result in higher premiums. Thus, small businesses, such as Ms. Howard's employer, are naturally going to bear the brunt of this ill-conceived Cadillac health insurance tax. Mr. President, as taxes increase to pay for the public option, so does the cost of premiums on health care plans. The Congressional Budget Office analysis on premium impacts estimates that family premiums, Mr. President, would increase 28%, from $11,000 per family to over $14,000 per family by 2019. This is more than a $3,000 increase per family. The bill also imposes $28 billion in new taxes on employers who do not provide government-approved health plans, and it charges a penalty of $750 per uninsured individual, a form of double taxation here. Furthermore, any opportunity to allow individuals to self-manage, Mr. President, their care and plan for the future health care costs has been eradicated from this proposal as it's now written. Flexible spending accounts help individuals and families pay for out-of-pocket medical expenses that are not covered by their health insurance plans with free tax dollars. These are particularly important for individuals and families who have high medical expenses, such as seniors and those with chronic health conditions or disabilities. Mr. President, the current proposal before us will not only limit allowable flexible spending account contributions, but the limit is not indexed for inflation, which means that inflation-adjusted or real value of a flexible spending account will decline steadily over time until virtually worthless.